The number of COVID patients hospitalized in our area keeps setting daily records. St. Louis Mayor Lyda Cruzan emphasizing it's not just COVID patients feeling the impact.
They're not just taking care of COVID patients, of course. They have lots of other patients too. So you want to be sure that there are beds.
Stuck in basically a holding pattern here, Russell. She says this has been going on for days now.
Right now, Stacey Springstead should be here at SSM St. Louis University Hospital being treated for complications to the place where she had a tumor removed previously. But for the last 56 hours, she's been lying in a bed in an ER exam room in a hospital in the town where she lives of Farmington.
Well, I'm just trying to hang in there. It's not easy.
On Tuesday, Stacey Springstead drove from Farmington to SLU Hospital where her doctor is, but after 14 hours in an emergency room without being admitted, she decided to go home.
They just kind of had you in a holding pattern waiting for a room.
Yes. I guess all the rooms must have been full.
Back in 2003, Springstead had a benign brain tumor removed. Recently, she had some of the medical hardware installed at the time removed, then complications developed.
So there is the potential that you could have an infection inside your skull. Is that correct?
That's correct.
That sounds pretty serious.
It could be, which is why I'm sure they're keeping me here.
Doctors are keeping her at Parkland Health Center in Farmington. She went there Saturday about the complications, and the plan is to transfer her to SLU Hospital if and when a room opens up.
Saturday morning about 9 o'clock.
It's now Monday morning, and you're still in the ER?
Yes, I am.
I reached out to SLU Hospital, which said it's facing the same challenges other hospitals are, from rising COVID hospitalizations and a limited number of beds. In a statement, it said, at SLU Hospital, we have begun to scale back some of our elective procedures that require ICU stays, and we, along with our regional partners, participate in daily evaluations of our bed capacity, surgical case capacity, and staffing capacity to meet our patients' needs. In the meantime, Springstead waits.
They're saying here that they call several times a day and to inquire about whether there's a room or not.
So if patients have been kept in ER exam rooms until other rooms open up, what happens if all the ER exam rooms get full? That's a critical question that hospitals are facing if the number of COVID patients continues to rise. Live in South St. Louis, Russell Kensall, News 4.
Mercy is monitoring some patients at home while trying to keep hospital beds open for coronavirus patients. Mercy COVID Care at Home will offer remote in-home care and monitoring for those with mild symptoms who may need low flow rates of oxygen. Mercy tells News 4 its virtual team will monitor patients for changes or worsening symptoms.